the pharmaceutical companies are very interested in maintaining their annual income.
Yeah.
And if we cure people, then the annual income suffers.
Yeah.
And I'm not being dramatic here. It's in other parts of medicine too. I deal with children, as I said before, and many children are on psychiatric drugs these days. In Australia, it's almost equal to the adult rate.
Is that
You
right?
can have little children of 4 years of age on psychiatric drugs.
Is that right?
Oh, it's terrible. And they are addictive drugs, and they're liable to keep on going for their whole life.
Is that right?
So the pharmaceutical industry is very interested in keeping people going on their medicines. Now, of course, when something like Aliotin comes along, it will and can cure people, which it can do and does do. That is, not very happy for them. They would spend 20 minutes. They spend 20 minutes to stop that.
Is there annually in the States only, the total expenses, direct and indirect indirectly related to diabetes is $100 to $150 billion a year.
Between 100 and 150 billion dollars a year.
American dollars, not Australian dollars.
Really?
That's a lot of money.
It's a huge amount of money.
And then, but once people begin to use these pharmaceutical chemical drugs, they stay on forever until they switch to insulin injection.
Yes.
It's terrible.
That's
terrible.
It's an inevitable progress
Yeah.
from the tablets to the insulin. But not only, we must remember the human misery that's behind this.
Yeah.
I'm very much aware of that.
Yeah.
It's a terrible disease. It really is, where so much can happen to the person.
By the way, let me ask you straight. When you are writing this book, you are not paid for this book by us in any way?
No.
You are not a shareholder of our company?
No, I wished I was. Yeah, how about that?
Later on. But so you formed your opinion purely on your.
I did. Yes, I
independently.
I genuinely was very impressed by that study that originally was shown, and I found out that it's quite true that the study I duplicated myself in Australia. Yes.
I see. And then, so in your view, what is the difference? What is amazing about Aliotin compared with other treatments?
Aliotin has a remarkable ability to level out the blood glucose levels without any severe drops.
Okay.
And that is very nice.
Okay.
And it also has a remarkable ability to do it so quickly too. I can comparatively quickly, yet with a slow drop, maintaining a slow drop. And also has the ability to reverse diabetes entirely, which is really unheard of, and quite remarkable. Yes, it's a very wonderful product and very hopeful for the diabetic population.
Now, what I really like about your book was that not only Aliotin, you mentioned other methods, or you're just giving other recommendations, right? For example, exercise, probiotics, and grapeseed extracts. So tell me more about those recommendations you make.
Yes.
In addition to Aliotin.
Yeah, the book is about diabetes. It's not just about Aliotin. Aliotin is the star player, I suppose, but diabetes is a multi-function problem. Many organs involved in diabetes.
Okay.
So we have to look at it in a multifactorial way to treat it. And even diabetes without Aliotin will respond to exercise and diet to some degree, as most people would probably realize. And in the book we have a really simple exercise program for people to follow, which is self-limiting because it's based upon their heart rate and their person's own heart rate. We also have a whole lot of recipes which are low glycemic recipes too.
I saw it there. Yeah.
Whole
it's
section
chapter 7
on
or
that.
chapter 8.
Chapter 8.
Yeah.
And we also have a section on the trace minerals which are important in sugar control, and the background of magnesium and chromium. And you mentioned the probiotics, which are important because of the presence of candida in many diabetics, who are 4 times more at risk for candida infection than the average population.
Is that right?
Which affects the gut.
Yeah.
And the probiotics are bacteria which can help to keep under control the candida population. Those things are all covered in the book.
Yeah, and I also see many testimonials.
Oh yes, there are more than 40 testimonials there.
Yeah.
Very interesting testimonials. Now, like in medicine, normally, of course, testimonials are cast aside as anecdotal,
Yeah.
anecdotal.
Yeah. But we
when,
have
when you see 1,000 testimonials
Yeah.
all saying the same thing,
Yeah.
that is scientifically accurate.
Yeah. But
You know,
here
when you repeat something many times,
Yeah.
that is scientific fact.
Yeah. Here you are also reporting the 80% to 20% does the controlled clinical result too here. I saw the clinical result with 100 people,
Oh, the
80
clinical,
people
the
versus
study,
yeah,
the study
control
that was
group of 20
conducted
people. Yeah.
was in 1997, 98 or something?
I believe it was 1998.
1998.
Yeah.
It was on 80 patients using Eliotin
Yeah.
and 20 controls.
Yeah, that's correct.
And
yeah.
the average drop in blood glucose was something like 180, I think.
Yeah. At that time, the test was mainly for very serious people.
Oh.
So the blood glucose drop
Yes.
was quite dramatic.
Significant.
Yeah.
They had some very high blood sugar levels
Yeah.
there, I must say.
You know, let me tell you what I experienced last week when I was traveling to Korea. I'm 47. My high school classmate is already, a few of them became already seriously diabetic. One person I visited blind. He lost vision on both eyes.
Diabetic retinopathy.
Yeah, but very serious.
Yeah.
And then on a dialysis.
Yeah.
He has already lost 2 kidneys already completely.
Oh.
And then just basically bedridden and then just terrible.
The classmates.
Yeah, my classmate. He was a very healthy guy.
How long ago did this begin?
A few years.
Yes.
But even at that time, he says, no, it's okay, no, it's okay. But what I was seriously concerned is that I met other classmates who have started these diabetic symptoms.
Yes.
But they still say, I'm okay, I'm okay.
Human nature is
Yeah.
that way. I'm afraid we treat a lot of chronic disease,
Yeah.
which is life-threatening, and it's only in the last moment sometimes that people take it seriously.
Yeah, so that
Human nature is very
constant denial.
It's very amazing, really.
Yeah.
The most sensible thing to do is to look after yourself now,
Yeah.
because what you do with yourself in this
Yeah.
decade predicates what you're going to be like in the next decade.
Yeah, the two of my relatives, one was a pastor in Hawaii, seriously diabetic, and almost getting blind, and then he has to cut the toes because of serious infection, and he got completely normal with Eliotin.
Ah.
But interesting story is his sister-in-law was also diabetic, and then I recommended Eliotin because this is my auntie-in-law, right?
Yeah.
And then but she kept on saying, "Oh, I'm okay." Right now, she's almost blind, in hospital.
Yeah.
Serious problem.
Very sad.
Very sad.
Is it the Philippines, you say, or the Hawaii?
My uncle, who was pastor, was in Hawaii,
Right.
but this auntie is in Seoul.
I'm sorry. Yeah.
Terrible.
Because we have doctors in
Philippines.
who are using it with success.
Dr. Kano, right?
Yes.
Yeah, he wrote actually the foreword on your book.
Yes.
Yeah,
Yes.
yeah. And then, okay, anyhow, thank you very much, Dr. Sichel. Do you have
Yeah.
any further comments?
I think that I congratulate you, and I hope you continue to spread this news all over the world.
Yeah, and I wish you make a lot of money in Australia with this business.
Thank you.
Okay, thank you very much. Thank you very much.